What is holistic medicine and how does it work with diabetic patients? According to a paper by James S. Gordon titled Holistic Medicine Advantages and Shortcomings, holistic medicine is defined as an attitudinal approach to healthcare rather than a particular set of techniques. As stated in the name, holistic medicine treats the patient as a whole rather than just focusing on certain aspects or symptoms. A holistic doctor looks at the patient's lifestyle, spiritual life, and even relationships with others when treating them for a condition or ailment. This is an interesting concept because modern medical doctors only do this in specific cases, such as diabetes. Other than that, they usually treat patients based on issues seen by scans, by symptoms, or even in some cases, exploratory surgeries. While holistic medicine cannot solve every case, there are instances where it can be used and even has the potential to be extremely effective. An example of this would be a cold. Many people unknowingly use holistic medicine methods when treating colds, such as drinking herbal teas, hot honey lemon water, and using essential oils. An important thing to remember about holistic medicine is that while it is considered a science, it is not entirely evidence-based, meaning it cannot be relied on in life-threatening situations. People, however, can combine holistic remedies and modern medicine in order to treat certain conditions. An example of this is type 2 diabetic patients. Type 2 diabetes has become a public health crisis. The CDC states that over 38 million Americans have some form of diabetes. Within that 38 million, between 90 and 95% suffer specifically from type 2 diabetes. We know that type 2 is characterized by both insulin resistance and a lack of insulin production. With diabetic patients, they are required to make lifestyle changes in order to live with their condition. A few examples of lifestyle changes can include getting more exercise, changing a diet to include less carbs and sugars, and even drinking more water or focusing on diet and low-calorie drinks. According to a paper titled The Role of Alternative Medicine in Managing Type 2 Diabetes, a Comprehensive Review, it is stated that mind-body therapies, such as yoga and Tai Chi to name a few, have shown significant improvement in A1C levels and glucose levels when fasting. Using holistic medicines in tandem with modern medicine can greatly affect the financial strain on diabetic patients and their families because most of these holistic methods can be low cost or even free.